Complex regional pain syndrome, or better known as CRPS, is a form of chronic pain that usually affects an arm or leg that typically develops after an injury, a surgery, a stroke, or a heart attack. The pain that results from CRPS is unusually more intense than the initial injury. Unfortunately, with this physical pain comes psychological pain as well.
There's a number of factors that contribute to depression and anxiety as well for people who have CRPS, notwithstanding the severity of the pain. There's a tremendous amount of losses that are associated with the pain and the limitations. So oftentimes people will lose their job, they lose their hobbies, sometimes they can even lose their marriage. There's financial losses. So that's a main factor. But other things like insomnia, feelings about how it impacts the family in a negative way, those things all contribute to the depression.
Sometimes the severity of the physical and mental pain can cause people with CRPS to commit suicide, which is why CRPS is also known as the suicide disease.
Most of the times people have tried all different types of interventions like nerve blocks, pain medication, acupuncture, all sorts of things. And oftentimes, they just cannot get ahead of their pain. So they often feel very hopeless and helpless. They just don't see their lives getting any better. And another factor I think that contributes is that oftentimes the person who is experiencing CRPS feels like a burden. They feel like they're either a financial burden to their family because they're no longer able to work, or they feel like they're a burden because they can't pull their weight in their household or in their relationships, and that makes people feel like a burden. So I think, between the severity of the pain, and the fact that there is no cure unless it's caught very, very, very early, just leads to a lot of hopelessness and depression. And unfortunately, people do commit suicide.
Former special education teacher Claire Benedetto was assaulted by 3 of her students back in 2012. The injury sustained from the assaults caused Claire to develop CRPS, which has spread from her right shoulder to her left shoulder, her right leg, and her bladder. Claire Benedetto is just one of 200,000 people a year who suffer with limitations from this disease.
As far as limitations go, my limitations have been restricted so much. I just miss the person that I was, because I was the type of person who loved to dance, who loved to go on hikes, who loved to walk her dog, who loved to just clean the house and cut the grass and do so many chores. And because of this disease, my results and my limitations have changed. I can't lift, push, or pull anything more than 5 pounds. I have to use a walker when I'm moving from place to place. I need my daughter to help me shower. I can't get my back because my arm doesn't reach back that far. And my daughter also helps me with some dressing, because to get dressed, sometimes to pull down a bra or a shirt, whatever the case may be, I need her help in order to assist me, which is definitely not the person I was before all this happened.
The families of those with CRPS are also impacted by the disease. To help ease that impact, getting familiar with the disease and understanding how it affects people both physically and emotionally will help both the family members and the ones affected by CRPS.
It's important for family members to understand that somebody can have a good day and then, be flared up for the next 3 days and then not be able to do anything. And so, family members need to be realistic about their expectations. They need to understand, what factors can trigger a flare up. I think just being supportive is incredibly important. And sometimes there's nothing, family members feel like there's nothing they can do, but they need to ask the person, their loved one, how can I help you? What can I do? And sometimes the answer will be no, there's nothing you can do.
As far as tasks and responsibilities go, doing tasks that are extremely painful or difficult for those with CRPS is really helpful.
If they can fold laundry, then folding laundry isn't terribly helpful. But if they can't, cut the lawn or run the vacuum cleaner because they can't stand or they can't, walk, that's where it would be helpful. So just looking at, how can I help given their limitations? And that helps the family members feel less helpless as well.
There is no cure for CRPS, but there are many different treatments that patients use in order to try and tame their pain.
So I've tried many treatments to try to help me with this disease. In the beginning, I tried physical therapy, and then we moved into pain meds, pain medications in Rochester during 2012, 13, 14, and even 15, I believe. Rochester still believed in letting pain patients have narcotics. So I was taking Percocet while wearing fentanyl patches to try to help control the pain. And that did a real good job. And while doing that, I also got procedures done. I had sympathetic nerve blocks, and I also had sympathetic lumbar injections to help with the pain. So both of them, the stellate would go in the neck, and the lumbar would go in the base of your spine, and they'd inject some kind of like lidocaine with some other materials to try to help stun and try to help the nerves not be so painful. Well, after having hundreds of these blocks done, after a while they just started to lose their effectiveness like anything else. So then the doctors switched to medical marijuana. That is a huge thing now. Instead of opioids, is to use the medical marijuana, which is also very expensive. Just for a little bit to put in your vape is like $85. So that got expensive. Plus then I started to do ketamine infusions, which were $1,000 a piece, and you had to give a series of at least 2 or 3. And they were in Pittsburgh, so that, including the hotel stay and the gas, got to be very expensive. And then we tried other bouts of physical therapy and massage therapy and acupuncture therapy and red light therapy. If it's out there, I've tried it, and I still wasn't getting much until I found a doctor in Buffalo who was willing to put in a pain pump. And so from there, we'll just see what happens.
There's a number of coping skills that people with CRPS can use to help cope with the pain, as well as depression, anxiety, and insomnia that comes secondary to the disorder.
Technique that is very helpful as far as coping goes is relaxation or meditation, and that's helpful for minimizing pain and stress. It helps to reduce anxiety, helps people to fall asleep, and it's also very good for circulation, so it helps to keep the blood flow. Other things like distraction can be helpful. Oftentimes when people are feeling frustrated, depressed, or in a lot of pain, they have a hard time concentrating and focusing. So it's hard to read or do anything, somewhat intellectual. So just general distractions, such as watching movies, playing games, talking to people, that can be helpful. And then the other things are, generally just getting support, whether it's from friends, family, or joining a support group. And the other thing I think is very important, if people have a spiritual life or any type of faith, I think prayer is incredibly helpful, because it can be calming, it can be reassuring, and a lot of times it can help cut back on the hopelessness and helplessness from the disorder.
To support those who are suffering from CRPS and for more information, please visit www.burningnightscrps.org.